In advance for any and all technical difficulties. All right, here we are.
Well,
there we are, Lisa. Look at our horse.
I mean, are we here? Are we physically here? Are we mentally here? Are we emotionally here? I am very
I'm
tired.
all here.
I am.
Are you still drunk?
It is
I might still be drunk.
Yeah, yeah. And by the way, loyal watchers, we are wearing the same outfit that was not planned. This is the first time it's happened, so very exciting news for all of us. But yeah, we're definitely wearing the same outfit. Very cool. I
Here
am
we
very
are.
tired still, Kat. And also, we spent so much time together this week in person. It was so beautiful. Just
I was gonna say, are you
snuggling up.
mad? Are you mad?
No, well, I miss you. It's like actually, I talk to you all the time, and that's great. We were like hanging out together in person, not just on the internet, and it was great. It was fantastic.
I know. Yeah. For everybody who doesn't know, Lisa and I often come to each other's meetings. So like, I feel like if you schedule a meeting with one of us, you might be getting both. And I feel like most
You right?
people just know that. But maybe some people don't. I'm not sure.
They just went with it. We rolled with it. So that was good.
Yeah. No one seemed super surprised. I actually wrote notes about what I was going to talk about from JPM, and I've lost them already. I was just
Ooh,
looking for them. No, but like, no, we heard. Okay, so
JPM,
we had fun.
JP
We had
Morgan
fun. We had
Healthcare
fun
Week.
at JPM.
We had fun.
We had fun.
We did.
I do. Oh, can I like do a snark thing? I'm gonna do a snark. So like all these
Absolutely.
pretenders, and everybody knows that I say pretenders all the time. I actually stole that from Lisa, and I've like nonstop abused it to the point where it's like annoying. But
It's hers now.
there are
It's
some
hers now.
pretenders on the internet, and they post these dumb posts about where I'm so happy I'm not at XYZ conference. Better stay home and hang out. And I'm like, listen, that might be true. Good for you. Why are you taking the time to write a fucking LinkedIn post about it? That just makes
Yeah.
it seems like you
Listen.
wish you were there. Wish you were
No.
there.
No, just don't waste your time. Don't debase yourself to write a mad post about how you weren't at a conference. It's not helpful content. Nobody likes it. It's not cute. It's not unique. You don't need to do that. Just like and move on, or don't like and move on. Just you know what? It's okay. We already have a question.
Oh, weird.
Interestingly, thanks to Melissa Janino, who is obviously our amazing community manager, there more VCs or SU? What's SU in this case?
Startups.
Startups. Other
I
than
mean,
hangers on,
I
like
don't know.
pretenders. I
Pretenders?
mean,
Were there more pretenders? I think there probably are in
yeah,
general
there
more
were more
pretenders.
pretenders. There were more
For
pretenders.
sure.
There were more
Yeah.
pretenders. I think it's important to note that, like, for JPM Healthcare Week, once again, if you noted, I responded to this like 150 times probably on Health Tech Nerds. Shout out to Health Tech Nerds. I was like, no, startups, you can't buy a ticket to JPM. You only get invited. There's no going to the conference unless you were invited by JP Morgan Chase and you're a client or you're someone really special they want to bring in. You're not buying a ticket. So when you
Yeah.
go, you're going for one of the ancillary events, you're going to an event, you're going to hang out, whatever it is. Like, you're not going to JP Morgan's Healthcare Week events unless you were specifically invited. So don't ask if you can get tickets. You can't get tickets. And so I
Yeah.
would say there were a lot of VCs like inside, and then there were a lot of startups and other people who were interested on the outside around. And that was the case. But there was some cool stuff happening on the outside this year. We had a great time.
No, listen, I had the best time. I also feel like you get what you put into events always, right?
Right.
And we put a lot of effort into partying. So, so
We
that was all
really
right.
did. And just like the most Dolly Madison style partying too, right? The
Oh,
kind of
yeah.
like,
Oh, yeah.
we're here to like do some business and also do some partying at the very same time, and it worked weirdly.
It always, listen, that's what I'm talking about. It always works to take the Dolly Madison approach. For those of you who don't know, Dolly Madison does not receive the credit she deserved. That girl saved the union by partying. So I am on that train 100%, bringing people together, doing stuff, doing business, blah, blah, blah. But we actually, okay, so we did learn some real things, which I can't find, but I'll probably remember. Lisa, what were your hot takes? What were your hot takes?
Yeah, I mean, I think that there, unfortunately for Kat, kind of immediately after and during, there were like some really interesting announcements, which I don't have in front of me right now in terms of like funding announcements.
We
Just
lost him.
sort of
We lost him.
like immediately three important sort of digital health tech announcements of funding like followed or happened at JPM. So not an amazing sign for Kat's long cold winter. If you want to join me on the beach, I'll be on the beach. A lot of people saying, including friend of the show, Brendan Keeler, that we might be back, baby. So we don't know.
Yeah,
We
that
don't know,
guy's
Kat.
often wrong, but never in
Often
doubt.
wrong.
I say that with
Confident,
love because
confident but wrong.
Keeler.
Confident but wrong at times.
That's
Confidently
fine
wrong.
though. Often wrong, never in doubt. Love that guy. But actually,
Wrong
I'm Team
never.
Winter. I'm Team Winter. I'm Team Winter. No, 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 no. So like I did at least for what I care about, which is Medicaid and public health. Right? We talked about this, and I wrote a
Yep.
douchey LinkedIn post about it too.
It was
Like
great.
we were all like, we found like Rayhan came on and was telling us about investments in Medicaid. We were all like, yay, we're going to invest in Medicaid in
Investment
2024.
in Medicaid and public health.
We have like an investor that's going to be on our show in like a minute here, and we can ask her too. But like all of even the VCs who like we know like Medicaid more than most, they were like, yeah, that no. So there might be
No.
a warm, sunny beach for some sector or some verticals in our great industry here, but not the ones I care about.
Right, 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 right.
So yeah, so
Yeah,
it's kind of a bummer.
yeah.
Oh, you
There's
know what
also
else? You
some
know what
good
else we heard?
scuttle. Oh, go ahead, go ahead.
Oh, you just said scuttle, so I'm here for it.
Scuttle. There's also, again, just shout out, really big shout out to Health Tech Nerds for hosting some really interesting conversations and also being nice to us when we like stole their stuff without permission. And also, congrats and all
Yeah,
that good stuff. Um, there's
yeah.
a really fantastic conversation happening right now on Health Tech Nerds about the obesity, anti-obesity medications, the GLP-1 inhibitors that Kat is going to love when she finally reads it. Really talking
You
about
gave me the summary.
some really shady stuff happening with some of the telemedicine focused companies and their use of compounding medications in a it seems pretty just straight up illegal. Like I don't know law. I just think it's probably like actually against the law what they're doing. And that's super concerning for safety. I mean, again, not a lawyer, like don't sue me, whatever. But when I read that and I read the guidance, it just looks like those things are totally off and really dangerous. Compounded medications are dangerous and have a really checkered history. I'm concerned about it.
Yeah. You said you I don't well, you should repeat it on our show because it's free for all here. But what an analogy did you use or what risk didn't you say we're going to get fungal meningitis from injecting ourselves
Oh
with
yeah, well
compounded
that's
pharmacy
probably
materials?
the most yeah, that's probably the most well-known, sort of outbreaks from really shoddy and dangerous compounded medications. There's fungal meningitis. People had massive outbreak of that. It was like more than 100 people. And again, I don't have a lot of sympathy or empathy for pharmaceutical companies, but also, this is the process, right? They come out with medications, they have some kind of patent protection for a long time, and also accordingly, the FDA has to approve that and also oversee what they're doing. And that's very different than compounding pharmacies. And I just don't understand how a big health tech or telemedicine company with backers and years of various types of support and employees and oversight of some kind can just be out there selling this stuff without any protections that we can see. Very
Yeah,
concerning.
I'm just going to go back. I'm just going to keep bringing up OxyContin and that
Yeah.
marketing plan. I'm just going to keep bringing that up. I know some people, I receive a lot of LinkedIn hate mail whenever I trash talk
Aw,
GLP-1s, which obviously I
yeah.
freaking love because,
It's
I
from
love
half of
conflict.
it is
But
from me, by the way. I send half of the hate mail to Kat. Just to be totally clear.
oh my God. I don't know. There's no free lunch, y'all. This is,
But there is free lunch and free dinner and free drinks at JPM.
At JP Morgan, yes, that is true. And we ate a lot of it. Like how many little tuna appetizers did we eat?
I mean,
Anyway,
I don't feel well. I don't feel well right now because I literally had only finger food for like 3 days. I am
yeah,
not.
but it was
It is a
delicious.
struggle. Yeah,
You
yeah.
know, and so many
So,
cups of coffee. Speaking of incredible food and cups of coffee, we went to Alia Suleiman's McDermott and Ernst& Young event or EY event. And we obviously went to her session, which was the best session of anywhere, obviously
so
in San
good.
Francisco. But
Sure.
before her session, we also heard the payer panel. And do you remember those people were trash talking Medicare Advantage, and I was into it.
They were very negative on Medicare Advantage. They were like, it's over, fun's over,
It's
go
over.
home, take your toys.
It's the
They
end.
were really, really, really quite negative. Oh, just a quick note from obvious friend of the
Ooh,
show,
there she
Eileen
is.
Silliman, saying that that FDA is now going after physicians and pharmacies engaging in the practice of using compounding pharmacies for GLP-1 inhibitors. So totally. Also,
Yeah.
shout out here to our chief patient officer idea. Really think a chief patient officer could really help with some of these issues. I agree. If I
No
do
big
say so
deal.
myself.
Absolutely.
Yeah, no big
Yeah.
deal.
Shameless plug. Shameless plug. Yeah. Alia's
Shameless
also
plug.
coming on our show real soon when I send her all of her date options, which are every Friday. She can come on whenever she wants. She's got some real hot takes. She's got some real dirty dirt on the HTI one rule. So shout out to her. We'll do the thing. But also thank you for inviting us. We definitely felt like the coolest people on the planet strolling in. So like, yes, we
Yeah,
were.
we were. We're pretty
But yeah,
pretty awesome.
Medicare Advantage is dead. No one even cares anymore. It's basically over. On we go. Blah blah blah. What else we learned? I found my notes, so like it's gonna be great. Oh
Well,
yeah, we
we
were gonna
learned
talk about like the fact that yeah. You go.
we learned again, obviously, that we are either, depending on how you phrase it, a whale in a glass of water or a very big fish in a small pond, and that the actual pond or the actual ocean or the actual source of water is, in fact, much greater. And there were so many really, really interesting people working in biotech and working in medtech. We got a little bit of exposure to, which was really neat. We met a bunch of them. We told them all about the talk show. I hope they're here watching the talk show.
I'm sure
And
they're
we're
here.
like, come on, it's going to be great. Come on to the show. And which is very effective. Talk show is very helpful for making new friends. Thanks to all of our new friends who might be watching. But just some really brilliant people, including some really brilliant women entrepreneurs in the space, which was just kind of like, because we happen to be women walking into these spaces that are full of the famed JPM blue suits, walls of blue
So
suits.
many.
Some
So
really
many.
freaking cool women came and talked to us, and that was neat. We have men on the show, diversity play here with all the men we've had on the show. But still, it's great for us to be able to be probably a beacon, or maybe a place where people come and talk to us, and talk to a woman in a room full of a ton of men. It works out for me pretty frequently. So
Yeah,
that was
no,
my
we
little
met some
takeaway.
really cool people, right? We learned all about molecules.
Molecules. Wow,
Med
we
tech,
are bright.
right? I mean, that's the thing. I know it was a big deal because a lot of times, Lisa and I we're basically famous to all 200 people in health tech, and it's nice to be in places where you realize that your whole world, like interoperability, isn't really that big of a deal. Like
No one
what?
cares.
Okay, Lisa. So the other thing that made your heart hurt a little bit, I think, was we were like having a lot of these conversations. We were like doing business, co meeting with a lot of people, and many people who are reputable, legit individuals told us Trump's back. So get ready, be prepared. It's happening. So,
Yeah, they
if
did.
you're like me, you're just going to move forward in the environment you're presented with. Like, I'm ready. I'm ready for all scenarios. I'm ready. But it was interesting because it wasn't just like, oh yeah, like crazy shit's going to happen. It was like, this is what's happening and just get ready. It's going to be a different environment, right? Like
Yeah,
it was
yeah.
different. It was
Well,
different.
not to talk too much about my own political perspective here, because I am also, like anyone who's had to work in any sort of political environment, an opportunist, where I would like to see good policies move forward, no matter who is in
That's what I'm
office.
talking about.
That's what I do. I would say that you noted that there was a difference in tone between the generally San Francisco, California audience and sort of where you live in Atlanta and in more or less in the Southeast. So you were saying you were surprised that the perspective of the business people that we met with
Yeah.
potentially in San Francisco is very, very negative, like, oh, this is over. Trump's definitely coming back, change in administration. And then you're hearing people saying, nah, it's not going to happen. This is very interesting.
Yeah. Y'all, I live in the South. Like, I know people say Georgia's purple and purple. It's not purple. That's not real, right? Like, it's a red state. Like, it's going red, at least from a presidential perspective. And so, but I do not hear that same tone here. So it was really interesting. I thought it was, kind of a good gut check, and we'll see what happens. But we also have to shout out Darshak.
Oh yeah, of course. So this was super, super exciting. So Darshak Sanghavi is a former colleague from CMMI, done some amazing things in his career so far. He's a brilliant medical doctor and public health professional. And he recently joined ARPA-H, the wonderful new independent, technically, but sort of under NIH agency, part of HHS, that is like the DARPA for healthcare. And they're taking these big swings and investing a lot of money in unique ideas. They have a lot of them that are in the biomedical space that are like cool new technology or cool new tools that could, change people's health. But then Darshak walked in there and he said, I want to change the way we pay for public health, which is a huge deal. And they were like, are you in the right place? And he said, yes, and here's why. So he has been working with a team of really great people for a number of months, including some former colleagues of mine from CMMI, to get this program off the ground, called Heroes, which is around healthcare outcomes and the way we pay for healthcare outcomes. So they actually announced the program. They're going to be looking at potentially 4 different outcomes: opioid use disorder, alcohol overuse, severe obstetric complications, and then also cardiac risk score over 10 years. And they're going to narrow it down to 2 as soon as they get more feedback from the community, and then find a really unique way of sort of paying for these outcomes by the government being the first money down, essentially. They're going to be doing a public-private partnership. They're going to be guaranteeing some percentage of that and trying to improve those outcomes significantly over a period of time. And it's a really unique program. It needs investors. It needs health systems. It needs communities. It needs a whole variety of different players, infrastructure, data, to come together and try to really specifically target one of these outcomes in a specific community. So they just announced, we'll link to all the stuff in whatever our wrap ups, but they are doing what's called a Proposers Day on February 13th and 14th in DC, and they're going to be open. And they did sort of a pre-announcement. It's all on sam.gov, the most amazing website to find government opportunities. Just kidding, it's really terrible. But they're fantastic. And if this is something you want to be interested in, it's going to be all over website. It's already there. Get involved, give your feedback. It's like a really creative idea, and Darshak and the team are really wonderful, and they are really excited about moving innovation forward in how we pay for public health outcomes.
Yeah, shout out.
What a like lovely person who is unending energy. Darshak was in meetings like for like 15 hours a day, and then at all of our parties.
And then he partied with us till like 1 a.m. That guy's great because he's like stealth awesome, like because he'd be hanging out with us, right? I mean, we are the most important person to 200 people, but it was really cool. He's got his heart in the right place. He's driven, and we are very excited. It was a bright spot for public health that he was able not only to present and do
maybe
all
the
that,
only one
at. It might be. He presented at the JP Morgan conference and met with some very cool people. We were like, oh, because he's like hanging out with us. So we were like, well, we're a big deal. So that's awesome. So, okay. Best party?
I mean, I think the food was best at the Cooley party, as we noted. They had like really high quality food, really beautiful like fish stuff, dumplings at the top of the Metreon, which was back in the day was like the center of downtown San Francisco. Yeah, it was pretty great. That was nice. That was good. There was the Mince party, which was held in the former, if you're from the Bay Area, Ruby Sky. It was in this sort of concert venue. They did not have amazing music. Sorry, it was okay, but it was more like letting people talk. But it was in this like ridiculous club venue, which was kind of hilarious. What else? What was your favorite one?
So my favorite overall was the Define Town Hall Oxyon party. Mostly because all of our friends were there. All of our friends were there, and it was really fun. And it was like a later night party, so maybe we were a little drunk when we got there. I don't know. Maybe I was. I don't know.
Maybe.
But I agree. There was good food. A16Z had good food too, but like it was early for us.
True.
We hit that one early, so we didn't eat all of their multicolored hamburger buns. That's fine. Maybe later. I did have a good time there, and then I actually had a really good time at Shuchi and Ritesh's party, the ServiceNow party that was like at their office, but they had that guy making tacos. That was good.
That guy was pretty great. They had it to Carol. That was good.
Yeah, it was really good. So that was a good time. Everybody was happy
on the rooftop.
Yeah, but okay. So this is the last thing we're probably gonna say because we got to get our legitimate guests on and stop talking about parties. But best party of the week was Madhura Singh making us dinner in her actual house.
That was the best party
from Divine, Chris Klump, and then and Darshak came to
Darshak.
that too, and that was really cool. So Darshak just keeps showing up. That guy just keeps showing up. So here we are. Yeah. Okay. All right. Is it time for like real guests? Okay. Great. All right. We're gonna
Real
actually
guest.
have a real investor here to tell us about investor
Amazing.
things instead of us just talking about parties. So welcome Archana Sahay from Northwestern Mutual
Future Ventures.
Future Ventures. Welcome. Introduce
Thank you.
yourself
Thank
for
you so
us.
much for having me. I don't know about legitimate, but I'll try to sound as legitimate as I possibly can be.
I think you're gonna do fine.
That's okay. I mean, we warmed up the crowd for you, so don't worry. It's only up from here.
With that disclaimer, in case anyone's gonna.
We are not legitimate. We are the opposite.
No, we're just here. We're just here. Oh, did we lose her?
Anything
We might.
she's
Oh,
doing.
she's back. She's back. She's back.
Oh, sorry. Yeah, the internet's wonky. We have a
Great.
snowstorm here in.
Oh, God bless Milwaukee.
So,
Yeah.
apologies.
All right.
It's our state of play for like.
I understand. So yeah, introduce yourself, tell us your things, and then you guys, to our loyal followers, this is a weird show because both of our special guests actually sent us some notes about what they want to talk about.
They were
so
prepared.
So please, Archana, take the mic.
Everybody, thank you guys.
Uh-oh.
A little bit
The
of
snowstorm's getting to us.
Oh.
Uh-oh. It's fine.
Oh,
it's
can you
fine.
guys
Keep
hear
going.
me?
Keep going. Yes.
Oh, I'm so sorry. So I have a platform for NM Future Ventures. We're based in Milwaukee, headquartered here in the Midwest. We have offices in New York City. We are the CVC for Northwestern Mutual. We invest nationally in fintech, insurtech, and digital health opportunities. Fintech, it's a pretty wide swim lane, essentially everything that fits under that umbrella. We have advisors that deliver, quality client experience. So anything that helps them sell, retain, et cetera, that supports our clients. Also,
Oh no.
so that's going to be okay. It's going to be life insurance only. So pet insurance. I have a pet. Totally get it, but unfortunately, we do not sell pet insurance. So, but we can connect you to some really great folks over at Nationwide.
That's awesome.
And then digital health, similarly, things that support, health outcomes and the connection to financial outcomes. That's obviously right in our wheelhouse in terms of a life insurance company. That intersection. The conversation is something that I put in about. I personally think it's so. Oh gosh.
I'm so You're back. Just
longevity.
Keep going. Longevity. Okay.
All right. So longevity conversations.
Yeah. So you sent a lot of interesting things, but I obviously we love the point that you made in your notes about AI. I think you said you are so sick of Gen AI. So I want to talk about that. Hoping that we can get you. Oh, so bored. So bored. But then so let's talk about the longevity thing next, because that's we haven't bitched about that yet. I was just in Poland. They had me moderate this panel on longevity solutions, but I only got to talk about commercialization. Thank God, because I don't know anything about longevity. So talk to us about that's interesting that you're coming from, a financial services organization and you're interested in longevity. So tell us about that.
Well, I think it's specific to life insurance. So life insurance, longevity, what happens to actuarial tables when people are living to 120? And I say that, I don't have an answer. I don't know that anybody has an answer right now, but themselves, the data that goes into those actuarial tables probably needs a little bit of a revamp as well, and to think on what it means when we're living to 120. Also, the data sets that go into the actuarial tables. Just imagine I'm wearing an Oura ring. Folks have, all manner of digital devices on them that are tracking their health outcomes. How are we looking at that? How does that inform an underwriting decision? How does that go into an actuarial table? Just lots of questions, not a lot of answers. And those tables are old, they're old. So,
Uh-oh. We keep getting the freeze, unfortunately. Maybe,
I
even though
wonder.
this is a visual talk show, maybe
I wonder if we
Archana, you
turn
can,
you. Yeah, turn off your
yeah,
camera,
turn your
Archana.
camera off.
Yeah.
That's a good trick for this stuff. Even though
There we
this
go.
is
Okay, keep
a
talking.
visual talk show,
Keep
why not?
talking.
Keep going.
Yeah, keep
Okay,
talking. Keep
so actuarial
talking.
tables. Update your actuarial tables, basically, is what I'm saying. Is this good? Is this working now?
It's working. Yeah.
Okay. All right. Well, that's great for me. Now I don't have to worry about my facial stuff. Okay, good. So I would say, so again, the conversation on longevity, people are living to 100 and or potentially
Just doesn't like the connection, tragically.
people, but it's also,
Yeah.
it's also, ugh.
You know what, Archana? We are gonna
Yeah.
we're gonna probably kick you off, and we're gonna bring you back on when it is not snowing in Milwaukee. But we're
That
probably
sounds
gonna read a
great.
couple
Like
more.
June. Is it June or what's
Yeah.
the?
Yeah, when does it stop snowing in Milwaukee? Yeah. But,
June.
yeah, we'll bring you back on because you have some great hot takes.
No problem.
Please stay safe in the snow. You're
I'm so
awesome.
sorry. You're awesome.
Oh my gosh. You'll be back. Hold on. We'll move to Lisa and I real quick, and we're just going to cover a couple of. See, it's amazing she sent us notes because we know what she was going to talk about. What?
I
the
know.
hell?
Okay, well,
Yeah.
everyone, this is a live talk show, and anything and everything can go wrong. We do not prepare, as you know. Famously, we do not prepare, and sometimes things happen. So there you go. But Archana had amazing
There we
notes
go.
for us, so hit it.
Yeah. So she did say she's sick of Gen AI. Or not. I think she said truly she is so bored. I'm just going to read this to you guys. Yeah. So she also has a blurb in here about how boring it is. So she says, I find the conversation centering on Gen AI incredibly boring. There, I said it, hear me out. Now, we've been surrounded by AI for decades, and I have plenty of excitement for search engines, my Amazon Prime list, and my Netflix algorithm. Maybe my issue is with the word generative. Rather than Gen AI, what we really have is recombinant AI. What is that? That's for me,
That's
not her.
totally
A
true.
model that takes in all manner of existing material and recombines it to present an answer that to us seems novel and new, but really it's simply processing and recombining data at a rate higher than what our human brains can. Boom. But that data exists because of human creativity, the human brain to begin with. So what does that mean? Does it mean AI is just big data? We will be exploring this topic much more. I freaking like that. I like that.
I mean,
Big
that's
data.
really the
Remember big
criticism
data?
that's the criticism that I really have of the whole thing is, right? It's like, again, I just want to be totally clear. Everyone needs to understand that, like, the chatbots that you are talking to, they are not intelligent actors. They are not beings. They do not have awareness, no matter what they will tell you. They are literally just very fast recombining engines of data that's been fed into. And by the way, that data was captured and used without copyright, without permission in many cases. There are tons and tons and tons of stuff, out there right now. There are lawsuits from creators of all types. And then there's this really, really, really annoying ad for C3 AI. Sorry, guys, that keeps saying that they have like IP, like free AI, or like AI that's not going to get you in trouble because you're a big business. Listen, there is not one generative AI chatbot that has not been trained and created using data that were stolen. And whatever, I'm not judging you, right? I've also used ChatGPT, but listen, it was stolen. And so there's a problem with that too. So not only is it not actually smart, not actually artificially intelligent, number two, there are some super serious risks with these tools that have not been resolved yet. And I really just want to caution people from saying that you're going to be that these tools are actually artificial intelligence. They are using various tools and techniques, but they are not intelligent actors. They are recombining things that sound good to us, which is great.
It is cool. It is totally great.
That's really neat.
So Archana also made the comment that there's some things that she would like Gen AI to be applied to. So one is pricing transparency, which is a hot
Totally.
feeling for you. You have the hot feelings about that. And then an AI co-pilot for a physician. So just going through it sounds like all that data up front, like totally. I will go back to Nikhil saying originally, those are maybe dumb things. They're not like dumb, like, because I know we have like a stalker, like our show has a stalker who sometimes like says stupid stuff about things and like misinterprets our common folk language. But when we say dumb, it doesn't mean they're like not useful. It just means it's not like, hot shit stuff. You know what I'm talking about. So anyway,
That's smart. It's
we'll
not
see.
exciting.
Looking forward to getting a comment on that. It's my favorite. But so
Listen.
another piece to longevity. So I do want to talk a little bit about this because that panel that the wonderful people in Poland had me moderate that I was not qualified to run. It was actually interesting because we were the two real panelists with us were a gentleman, Maciej Banach, Dr. Maciej Banach, from Poland, who was talking about how to get some of these nutraceuticals, which are proven in certain studies to do amazing things and improve longevity. And then we had Zori Dimitrova from GlycanAge, which is measuring a different type of biomarker, I don't know, to help determine like your actual age. Like, are you on track? And the bummer about some of these technologies, and so my role was to talk about commercialization because that's all I'm good at, was that like the biggest problem with some of these barriers to commercializing those longevity solutions is access, like severe lack of access for, basically anyone who is not rich, right? Because you're paying out of pocket. Insurance doesn't cover these, especially in the United States of America. And so I'm interested in seeing what that space does too. I don't know if you have feelings on that, Lisa, or if this is taking us back to GLP-1.
I mean,
I'm not sure.
of course I have feelings on it. First of all, because my dad intends to live till he's 100. He's told us for a long time. He's 76 now.
Nice. I'm here for it.
He is like a Cat McDavitt style, like ice bath, freaking like UV light, whatever, like one of those weirdos. He's a vegetarian, doesn't eat a lot of vegetables. He takes about this many supplements he takes just a massive quantity of supplements. He's really serious about that lifestyle. And for me, I'm like, you know what? Like, obviously, I don't care about actual longevity. More interested in things like health span. There's obviously the lifespan, health span commentary, right? Where you say, it's not for me necessarily important that I live until 100, but that I have 80 really solid years and I feel really great, or whatever it is, maybe 90 solid years. Where I'm feeling, able to do a lot of activities of daily living, where I feel pretty good, all those good things. So for me, health span is more important. And then from an equity perspective, I care more about the health span and the lifespan, but also the health span of multiple different people from different groups of life, not just my dad, who's like a rich guy who lives in New Zealand, but also, people who are receiving healthcare through Medicaid and who are living in not the fanciest places in the country, right? I care more about having that be more equitable and having more opportunities for health span and lifespan for people across the country. And it's not looking good, right? Like, again, the US is this country that has on average, reasonably good numbers, although they are dropping pretty drastically. But then if you look at different populations and different races in different parts of the country, the numbers are real different, and it's not good, and you get pretty depressed pretty quickly. So I am really most interested in how we can make that a little more equitable, and not necessarily about who's that really weird rich dude, the one who's like trying to become like he's like injecting blood in his face. That dude.
Yeah, the vampire
I don't
blood
care
guy.
about him. Brian.
All the pills.
Brian something.
Archana says Brian.
Brian Johnson.
Yep.
That dude is weird. And I don't care about him and his like weird quest to become like the youngest old man or whatever. He is not interesting. He is taking energy and money away from people across the country. No. But yeah, that's kind of
okay. But back to the great American capitalist dream. Like, that guy can also do whatever he wants. Like, I'm here for it. Like, it's like when General Catalyst was like, I'm gonna buy a health system. I was like, fucking go for it. Like, go buy that health system. You go. God bless America. God bless America. But yeah, no, I do agree. I think in general, there are a lot of interesting tools in the market, and I'm conflicted. The other thing, Archana, I'm so sorry if we're taking your notes in like the weirdest dumb direction ever. But y'all saw there's the debate, and we're not in medtech. I don't really deal with CLIA companies, but there's regulation coming out about like, oh, we're going to start regulating some of those tests more, because like, I don't know if anyone knows this, CLIA's dumb. So, and there's all this drama, but one of the good things about CLIA certification and like, being able to like fling stuff out in the market is that it does remove some barriers to access, but then it also takes us to this fucking shit we got going on with the GLP-1s, like, whatever. Not the same, but similar. Like, do you want super low barriers to access for diagnostic tools that actually can change the direction of your health and pharmaceuticals? Maybe not, but like, I don't know. It's a balance, blah, blah, blah.
Well, CLIA famously, actually, to be clear, CLIA was, and the various investigators from CMS were one of the only reasons that Blood Lady, what's it called? Theranos was even caught. Just so you know, he is dumb, but they did catch Theranos.
They did it.
And
A little late, but they got her. They got her.
Little late. They got her. They got her. We did it.
So the last thing that Archa sent her in her notes, which I love, and we heard a lot about this at JPM, menopause care, women's health in general, and then specifically menopause care. I feel like it's like having a moment. Like, I think hopefully it's not just a moment. What do you think?
I mean, as someone who is probably going to be going through menopause pretty quickly here, I'm excited about not feeling weird about asking for hormones and thinking that's an okay thing to do to get treatment versus just being told to suck it up like everyone else has forever. I worry about telemedicine only options as per usual, as we just talked about. I think that, some of these telemedicine companies are really not necessarily operating their businesses in the best possible, most ethical, above board way. And I do really get concerned about that. On the other hand, I do think that telemedicine care is really important for access. And that's where a lot of the menopause care solutions have fallen so far. I would love for there to be better menopause care options for everybody and not have it be just those people who can access and know how to use those new telemedicine companies that are out there. So I know some of those folks, maybe Health, for example. I do think that they're really trying to get more visibility for menopause care, and they're trying to end any kind of stigma around it. All that is great, but who does it get to is always my question. And is there enough clinical oversight? Does it matter? I mean, the entire experience of women's health care in general is such a dumpster fire that there's a lot of work to do.
Not ideal. Yeah. I'm also interested to see in a year, measuring back, because there is a lot of enthusiasm around women's health. And I'm interested to see if that is real or if that's just like the ether, right? So I'm interested in that in the big time.
Just one other thing on that note. I have a fun fact, which I read, which is very upsetting. Pap smear, which is a procedure for detecting cervical cancer. It involves taking a physical swab, getting a sample. It's not super comfortable. Got to do it every so often. It has saved a lot of people's lives and getting, early detection treatment. Turns out the guy who invented the procedure, the way that he did it was literally because he didn't have approval for human subject study. I wish this were a joke. He did a pap smear on his wife every day for a year or more. Just so you know. So if you are a person with a uterus and you're hearing that and you're getting a little clenched, I'm sorry. She deserves a medal, like a statue, Yeah,
we should make a statue. We should get her a statue.
I mean, I don't even know what to say beyond that's pretty messed up, even though I'm grateful that the procedure exists and that we can prevent cervical cancer, but yikes, not ethical. Speaking of whatever,
that is
give that woman a statue.
Joking.
No joke. We actually have a comment from one of our super fans of the show. Super fans, someone who also showed up to party and maybe do some business. Paul Wilder from our friends at Commonwealth, who is apparently using AI to game the comments section of the Health Tech Talk show. And
I'm into it.
That's amazing. We love it. Keep doing that.
God bless Paul Wilder. That guy always, listen, Paul Wilder, you need a friend.
Always shows up.
Paul Wilder
always shows
up. All right. Okay. On to, okay. So we were just talking about JPM and all this freaking money. And so let's talk about the end of the world as we know it. We have Marie,
it's coming.
Talk show guest.
The end of the world.
So Marie is CEO of Horta Health. She is one of the few climate and health experts that in the world, as far as we know. And she's also our favorite. So she's back here to give us some updates and bring us down to earth, because we're just talking about all this money and eating tuna appetizers,
shoving the money around, eating some free dumplings.
Marie, so many dumplings. Oh my God. But anyway, so Marie, aside from the energy that it took to make these dumplings and for all of the Ubers that we took to destroy the environment, most of which were Teslas, that's fine. Tell us what's going on, because you sent some pretty interesting thoughts to us as well, and some studies and conversations that have come out.
I'm so happy to just see you all in chat. And I'm going to take the title of favorite, but not world expert. You know,
And to us, you're a world expert. You're definitely the preeminent world expert that we know, and that obviously matters more to us than anything else. So continue.
do you know what
That's right. That's right.
I want to be a bridge because I think there's this community of people who's been doing this for 30 years, but they exist in a silo separate from what we do, right? Like health tech. And so I was talking to somebody about this today. You know, I think this is a lens I hope we can bring to all of our work, whether value-based payment or data. And I really like that work, right? So I'm sort of here to say, like, hey, here's the lens that we can bring to our work rather than recreating the wheel. In terms of where we are, so last time I talked to you, the White House had just put out this shiny report talking about resilience and adaptation. So exciting. We were heading into the UN's health conference, which for the first time ever was having a climate day. A bunch of health scientists had just put out a big report in the Lancet saying, hey, like, this is getting really serious. And so we're sort of in the wake of that right now. So tons of energy and excitement around health, this first health day, a lot of shiny commitments. There was a commitment of $1 billion to climate and health at the UN Health Conference. And a big, oh, go ahead.
Oh no, we were just.
That's the background. That's a background noise. I don't know whose it is.
My children are playing the piano. Let me put myself on mute.
Yeah.
And I think this sort of interesting statistic that 24% of coverage of climate-related events now mentions health. So it feels increasingly, right, like health has entered the climate narrative. And I think the question I was sort of talking with Kat a little bit offline is like, so what, right? Is this real? You know, there's things that point to us paying more attention. But also, I think you need to pull back the onion on that a little bit. So a couple other things that are happening. You know, Vanessa Carey, who's been a vocal activist in this space for a long time, just put out a really interesting piece yesterday pointing out that that $1 billion is actually funds that have already been allocated. Or they're restricted. And so sort of just calling it to say, hey, we've recognized this as a really big issue. We had this big shiny announcement saying that we were putting $1 billion into this. But when you actually look into where those allocations are, you know, it's funding that's already been committed to other things and often much more narrow things. And so that leaves us in a lot of ways where we started, which is that only 0.5% of the budget for climate goes to health related issues currently. And yet we're taking up sort of health as the talking point, which has led people to start talking about health washing, which is the idea that we're using health to make the climate topic more palatable, but maybe not actually really meaningfully advancing the conversation. So
OMG. OMG. I like that. I mean, I don't like that, but I like that.
It's an interesting dynamic, right? Health has got a seat at the table, but are we being used?
Yeah. You know, is this like when the White House put out that thing, Lisa, where that was like social determinants, social care, blah, blah, blah. And it was like, I forget what the number was, but it was like $300 trillion for social care. And then it turned out like, it was like not like there was $0 actually. And it was all kind of like what you were talking about, Marie. It was like, oh yeah, like if Walmart commits to doing something on their own, we're counting that. Like it was all kinds of crazy bullshit.
But this is classic, like, this is like president's budget level stuff where they're just like, we made up a number and like nobody's gonna ever approve it. It's not actually gonna happen because we can't actually appropriate funds. But like we're gonna count like all these commitments that all these really nice business people made to us when they came to the White House for a dog and pony show and little razzle dazzle. Yes, we're counting that as the work that we've done. I get it, but you know what? These are not, like you said, Marie, this isn't real. This isn't real change. It's a lot of noise. It's pretty concerning. And also just like the practice, I mean, health washing, that works. That's great. I get it. You know, just the same way that greenwashing has happened in the past. It's a predictable bummer.
So so Lisa and I were talking about this too when we saw your very legitimate notes on what you wanted to talk about, Marie, which, you know, is weird for us. We were like shocked to see pre-planning, but we were like, okay, so like, what is it actually going to take? Because, you know, we just came from like capitalist land, right? Where like people follow the dollars in healthcare, and sometimes the dollars are in stupid places, so we go stupid places. But like, what do you think? What do you think it's going to take before anyone actually does anything?
Yeah, three things. I think the first is we need public health data infrastructure. And to me, climate data infrastructure is public health data infrastructure. The gaps that we
Love
saw.
it. OMG. Sorry.
The gaps that we saw during COVID, right? Our inability to sort of react quickly to things happening in our communities, how hard it is to look across state lines. All of those things are just, amplified in a more volatile climate situation. So I would say public health data infrastructure that has an eye to climate as a use case, like thing number one, and which doesn't disconnect public health from the health system. Right? Like, we're setting
We are getting
Your audio is a
some
little.
weird. Is it Marie's audio or is it someone else's?
Yeah, her audio just went off and came back on. See, this is the hallmark of the show, Marie. Congratulations.
It would not be the show without it. So
That's right.
Real.
So on the public health infrastructure side, I mean, what I think is kind of an obvious one, right? So one of the major public health harms is pollution, right, in general. And you can see it in my former home of Baltimore. There is a major plant that is putting out like pretty much black smoke all the time. And I'm pretty sure that that's not healthy for the environment or for people together. It's the same harm. And so that's just one example when you look across certain areas of the country that are less developed or less favored, you're going to still see those industrial polluters who are obviously harming the environment and also harming the people who live there. So those things are very connected. I mean, that you could say, well, that's going to be something you can put in the category of check, we did that for the environment, and check, we did that for public health.
Absolutely.
Stuff like that.
Absolutely, right.
Yeah.
I think it's like an extension and use case, right? If we're so fixated on claims data today, well, what does it take to link claims data to air quality data or to heat data, knowing that those are major drivers of ED admissions, right? And like public health crises in our community. So I think that's like important first thing that we should tackle. A second is priorities, right? And what we're monitoring from a policy perspective and flexibility. So I'll sort of put like policy as the second bucket. I think where states have been given flexibility, they've accomplished so much, right? And it doesn't take much to do that. So when you see like what Medicaid programs are doing in the context of waivers, where they are given flexibility, climate looks different in different places, right? And so if we can say to health professionals, like in your community, you have flexibility to use your dollars to react to health crises, including ones that are climate, I think that's huge, right? And so I think it's just thinking about it as a use case in the context of waivers and other things. But I also think it's thinking about it from a priority perspective. I think we've seen how much systems have been crushed by too many quality measures, but we also know that those things matter, right? So in a state, you're really seeing crushing environmental issues. I think it's worth it for programs to say, should one of these measures, right, be part of the set that we're monitoring to say, are things improving?
Well, it's pretty simple, right? Like one of the really simple ones is like asthma in kids. Kids are really, kids with asthma are really, 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 really susceptible to pollution, to industrial pollution, to street pollution, whatever it is. It's actually like really close. It's not like a stretch or you have to wait a number of years. Like if you have a massive increase in air pollution in a city, you are going to see a bunch of kids with asthma go rolling right into the ER or worse, right? It's pretty easy to see that connection. So I can't see why it wouldn't make sense for Medicaid or CHIP to be investing in things to stop that significant pollution, whatever the decisions are with the city or the town or the county or whatever it is. That results directly in kids with asthma getting really, really sick or dying.
Yeah, Elise, I think you put it so well. I think it's so easy to say, like, this is a separate issue. It's a big issue. Other people will solve it.
It's the same issue. Same. Yeah.
Like with asthma is an air quality issue, right? And I think if we can get it that tactical to say like, hey, like let's monitor this measure that really matters to the kids in our community, like that's a success. And then the final category, of course, is funding, right? And I think that's where we're really falling short right now. So many health systems have committed to the HHS Climate Pledge. They've identified a person in their organization, but those people don't have teams, right? And they're trying to work in a cross-functional way across, large parts of the system to support, reducing emissions. And that's not even necessarily allowing them to look at, well, how do we adapt, right? How do we make our system more resilient? And so I think there's no way around the funding question, right? I think healthcare operates on, funding priorities. And so I think The point at which we'll really start to see motion, right, is when there's funding attached to it. And I think from my vantage point, decarbonization is critical, and I'm so glad the health system is paying attention to that. When we think about the health system contributing, 9% to all of the US's emissions, but I think we're one of the only industries that can help with adaptation, right? To say, how is it impacting the most vulnerable communities right now in their health? And so I think we should, focus on decarbonization, but I worry that there's no industry but health, right, that is going to think about adaptation. And it is frankly just really a health issue. And so that's the place where I want to make sure that funding would go if we get some.
Yeah, that's super interesting as well. From a public health perspective, I would also say something that gets less attention from a public health perspective because it's different is injury prevention. Injury prevention usually includes things like gun violence and then also, cars hitting people. There's been a huge uptick in pedestrian deaths due to cars. There's a couple of different reasons, including more distracted drivers, bigger cell phone screens, bigger cars, unsafe roads. And if you think about it from an environmental perspective, these massive, massive roads with like no break or no ability for wildlife to transit, things like that, that's also an issue for the environment. And so big, big, big public health problems around injury prevention that also actually have relevance to the protection of the environment and improving the environment for humans and also our other animal friends trying to survive so that they can be put on cats or put in cat's freezer as delicious as it's in.
That's what I'm talking about. I just had an amazing analogy with my team about hunting elk, and I think they freaked them all out. But so, Marie, because I'm a positive person, I'm always looking forward. Are there any communities, companies, states who are doing like kind of a good job? Like, is there anyone like leading the way, like the guiding light situation?
Oh my gosh, totally. And I think that's been the beautiful part of this year, right? You're not seeing 24% of publications mentioning health by accident, right? Is because of this effort that's been happening for 30 years, where this small group of people, I think, has been really making these connections for a long time. And so, yeah, I think the organization Healthcare Without Harm, which is a nonprofit in the US, but operates internationally, has sort of been at the center of the decarbonization conversation and behind the HHS pledge. You see major health systems. I think Kaiser is particularly notable, but Advocate Healthcare is another organization. So you see health systems that have picked this up in a pretty banner way, that are gaining more and more momentum. I'm also seeing states that are doing really interesting work here. So Michigan has a climate and health plan, where they've sort of put out a whole, statewide strategy. The state of Massachusetts has a plan focused on adaptation and sort of decarbonization, which extensively mentions health in that context. So you're really seeing, as much as there's talking and not yet like a clear line to say, hey, this is how everybody does it. The number of conversations where this is growing is significant. I'm an advisor to a startup using generative AI to help identify and remove waste, right, from hospital settings. So I think across all sectors, right, you're sort of seeing people pick up the gauntlet, if you will, and try to move. What I would say is there's enthusiasm, but it's just hard right now, right? Anytime the policy and funding incentives haven't quite yet aligned, it raises this question of how do we scale this? How do we figure it out? So there's a lot of creativity and a lot of pilots. And frankly, I think there's folks who are leading the way, right, in terms of being ready to make some of these announcements in 6 months, in 12 months. I think in terms of broader scale, right, it's going to take those policy levers, but there's still a lot of movement.
Yeah.
Nice.
So, I guess like, is this kind of like a lot, because I live in a red state, like everybody knows. So like, Lisa's out there in California. They're like, they wouldn't even give us like paper cups at our hotel. Like, I was like, wait, what?
No.
Okay, so
You have
like,
to use your
like, different
hands.
world over here. I had to drink out of the faucet like directly. It was crazy. Yeah, it was like wild. Okay, but really, like for people like me who live in the South and like we don't even know stuff. Like, what's one thing that like, because I am into moving forward. Like, what one thing can like general humans who care about this do to, like you said, maybe in 6 months this has become a funding priority, or like what can give us some takeaways? Because I love the action.
Yeah. For where you are, Kat, right? I think it's normalizing the details that everybody cares about, right? So where
I'll go talk
well,
about it.
yeah, the example Lisa used, like everyone cares about kids with asthma, right? And
Yeah.
let's talk about climate change at all, right? Like you can talk about outcomes that everybody cares about. And secondarily to that, I think that there's decarbonization efforts. You don't even need to talk about climate, right? That are money saving. Reducing waste is something that everybody cares about. When you're wasting things in
Money
hospitals,
saving.
you're saving money, right? So I think there's a lot of tactics, frankly, in the umbrella, right, that help advance the conversation that are just like good business, right?
Totally.
And that maybe separate from the adaptation conversation, where Lisa can have that in California and start to push the envelope on that conversation. But I think there's things that make sense in the context of today, like we sort of talked about, that you can do without even mentioning climate at all.
That's
Yeah,
right. See, it's
exactly.
just like how Indiana got public health money pushed through without ever saying public health. I'll have to take
You
the
got to
same
do
approach.
what you
That's awesome.
can with what you have,
Yeah.
where you are, et cetera, et cetera, et cetera. So that's awesome. Thanks,
Finances.
Marie. I'm so glad that you are still moving us forward on this, and we're gonna keep having you back as our top world expert climate and health correspondent.
Also favorite.
Definitely according to us,
Favorite.
absolutely favorite one, top, best, world leading.
It's so nice to
All
see you all.
American. All
Nice to
right.
talk
All right.
to you,
You're the
Marie.
best, Marie.
Bye.
All right. Well,
All
Lisa,
right,
we
Kat,
got one
we're
more
almost done.
comment from we got one more comment from superfan Paul Wilder here.
This is a
And
great
it's
comment, and
basically
I totally
it's
agree.
actually a smart comment. Like Paul
Yeah,
pulls it
good one,
together
Paul.
when he needs to. Yeah. All right. So what does he say here? Any
So he's
telehealth
saying
without
rightfully that
okay.
any telehealth without interoperability is total BS, because how in the world are you guaranteeing that you are not going to be prescribing someone a medication that is not like a drug-drug interaction, or all of their comorbidities or co-occurring conditions, or have any idea of the safety profile? Are they safe? Are they physically okay? How do you know when someone calls you or whatever on the app and there you are and you're like, I'm going to prescribe you whatever it is? You need information. But Paul also kind of does a little bit of shade / elbow throwing here, which I appreciate. He says, and if you are supposedly doing treatment and don't invest in connecting the data from networks with data exchanging at scale for treatment, not sure you are, which I appreciate
Boom!
that snark. That's a real elbow to the gut there.
That's a
Prescribing
good
drugs without
elbow.
history is absurdly dangerous, and telehealth in particular gets less background data on check-in than, I assume, in-person care. Super valid point. Total BS. We don't like it. We don't like it.
We don't like it. We don't like it. I also saw this morning. I know we're talking about the GLPs, which like I just like makes me hurt. But I did see this morning that is it the FDA? I forget. It was in Politico. Had investigated some of the reports of these drugs causing depression and suicidal ideation. They have found no evidence that it does in fact cause suicidal ideation. So, but TBD. They're still looking. Apparently, I don't know.
Got it.
We'll
Got
see.
it. Again, I mean,
We'll
this
see.
is why, like, I'm sure that there is no drug that is safe to be prescribed to everyone. I am certain of that. And you do need a medical doctor usually, or a highly trained medical professional needs to be assessing a person and understanding their medical history and the other drugs they take and the other things that they do and what their life is like before they can safely prescribe them something that could
Yeah.
dramatically change their brain or body chemistry. It's just a thing. We still need medical professionals for that. We do.
Agree. And it also sets up, I know we're almost out of time, but Leslie Kirk, famous CEO of Incena, LLC. Her
Famous.
passion project is medical mistrust, right? Like,
Nice.
because let me tell you guys, I do not tell my physician how many drinks I actually have a week. I do not.
It's
But
50.
to that point,
50.
if you're showing up on the telehealth, like everybody knows how I get pink eye medicine, right? I show up with my mascara on with no pink eye and tell them I have pink eye, and they prescribe me pink eye medications, which I then give to my children, right? Because One
Yeah.
Medical, hey guys, does not take children. And listen, I am not going to the urgent care for that bullshit. But to that point, like there's just like so like telehealth is great. I love telehealth. This should not be the start of my rant that will take 20 minutes because we're out of time. But yeah, something that's potentially serious as these drugs, maybe not a telehealth option. I don't know.
That's a lot of value that you're just destroying now, Kat. That's a lot of value for a lot of investors. Don't say
I
that.
know. You know, I love value. I love creating value. It's one of my favorite things. Also,
This is
do love
amazing.
Tylenol. Please don't take that away because I do need that pink eye medication sometimes, and I'm not going to go to the urgent care. I'm not going to do it. So
That's
you know,
correct.
that's
We
what
are
I'm
out of
talking
time,
about.
Kat. We're probably cut off, but you're amazing.
Probably.
See you soon. And bye,
See you
everyone.
soon. See you soon. See y'all
Get some
later.
rest.
Goodbye. Good
Bye.
night. Happy weekend.